in progress.
Hi, Malini, you may start now.
Oh, good. Good morning. My name is Malini Raj, and I am your MC for today's event. I'd like to begin by acknowledging the traditional custodians of the land from which I am hosting this session today, and pay my respects to their elders past, present, and emerging. I'd also like to acknowledge and pay my respects to the traditional custodians of the various lands from which each of you are living and learning today. On behalf of the Mental Health Foundation Australia and Chairperson Vasan, Mr. Srinivasan, I would like to welcome you and thank everyone, each and every one of you for attending and this virtual finance health symposium organised as part of the Mental Health Month of 2021. I am the head of community engagement at the Commonwealth Bank, and with my close knitted work in the finance sector, I am very well aware of the mental health issues that this sector poses. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of the Australian mental health as a community. The Mental Health Foundation's National Mental Health Month is unlike many other mental health awareness campaigns. It aims to bring all Australians together in a nationwide conversation about mental health, and we aim to maintain this conversation for an entire month and beyond through various mental health related events. National Mental Health Month is a program that the Mental Health Foundation is extremely proud of, and we intend to reach out to and educate as many Australians as possible to help reduce the stigma and facilitate positive and non-judgmental discussion around surrounding the important topic of mental health in Australia. With one in five Australians experiencing a mental health illness, it is time we give mental health its due attention, and that Throughout this month, many events have been organised in each state and territory of Australia, aiming to attract and unite all Australians of all ages and backgrounds to raise awareness of the need for better mental health for all. This year's theme of mental health month and post-pandemic recovery challenges and resilience. This year's theme will focus on raising awareness about mental health in various industries and communities. Every individual has faced and are still facing unprecedented challenges due to the COVID-19 pandemic. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages walking on the road to recovery, fostering resilience. So let's begin with today's event. Please join me in celebrating the work of the Mental Health Foundation by reviewing a short video.
Hi everyone, I'm Vasan Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020 and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to a virtual platform, very much being able to pursue our objectives of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our National Walks for Mental Health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DB Results and take up the well-being app Am I OK? To support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, Am I OK? Am I OK also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors, and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organization. As we continue to work to deepen understanding of the importance of mental well-being and educating the community, let's work in solidarity for the benefit of our mental health. Thank you, Australia. Hi everyone.
Malini, you can start.
I would now like to invite our first keynote speaker for today, Dr. Amanda Ferguson. Dr. Amanda Ferguson is a published author, keynote speaker, and private practicing psychologist with a master's in PhD organisational psychology. She has appeared in print, radio, TV since 2002, and her first book, Life Works, Rediscover Yourself and Transform Your Relationships, has been published by HarperCollins and sold out in its first year. Dr. Amanda is passionate about helping people find meaning, satisfaction, and successful transitions in life, work, and their relationships, and has delivered keynote addresses on topics such as personal development, recovery from trauma and childhood issues, rebuilding relationships, workplace, career, and job satisfaction, and advancement and ambitious goal setting and achievement. Please join me in welcoming Dr. Amanda.
Good morning, everyone. So as a personal psychologist in private practice, as well as in organisations, I've obviously seen a vast array of mental health issues, financial issues, relationship, workplace, career issues during this pandemic and during the fallout, of course, the economic fallout. And those two major issues that we're dealing with, your workers, yourselves, are very much at the coalface dealing with the fallouts of the pandemic, social impact and also economic impact, of course. And it's affecting all of us in so many ways, all of these ways. And certainly the organisations as well, not just the workers, not just the leaders and employees. And so here we are to gain more resilience and to look at how we do that today, how we move forward. And my PhD was on worker engagement, employee engagement, burnout, and empowerment. And all these topics are now certainly coming to the fore. They're certainly under the spotlight for us as workers and in organisations. In this new era of uncertainty, we have to find our own way. We have to find ways that we can help each other and work together. And this uncertainty used to be back of mind, of course. We didn't like to think about life being uncertain. It always has been. And now, of course, it's front of mind. And this uncertainty is with us now forever. That's what the research is showing. Of course, the pandemic, the race riots, the natural disasters, climate change, political unrest, and economic downturn. So managing our mental health and staying productive, helping others as well, is more important now than ever. And mental health in the community and the workforce is now in the public domain, in the public discourse, which is a good outcome, I guess, of COVID, that we now are all willing to talk about mental health issues, all willing to cooperate, collaborate, and look after each other. And organisations are becoming much more proactive, certainly the good ones, in having psychological safety as a key part of their policy and employee management policy. And so many of us are caught in the brunt of both the pandemic and the economic downturn. In fact, we are now dealing with a public that's under greater strain than since the Great Depression. And of course, many of you are working directly with the public and facing all of that strain in yourselves as well as in them. So stress, exhaustion, burnout, being jaded, being anxious, being depressed, a loss of morale, loss of motivation and direction are all of the things we're commonly facing these days. And so our well-being and risk of burnout is something we're having to become much more conscious of than ever before. And in fact, this trend was occurring before the pandemic. Burnout was on the rise at an alarming rate. Now, of course, it's a mainstream problem. And our challenge as we go back to the office, and those of us who do go back to the office, because some of them, of the people I'm working with, certainly in private practice, are refusing to go back to the office. But we do know that productivity is best when it's done at least with some time in the office or with community, with peers, with colleagues, rather than completely away from colleagues. So that hybrid way of working is now very much here to stay. And it's how we manage that and how we help managers and leaders to understand hybrid working and to give them support in their ability to do this. And design the best possible workplaces for this new hybrid way of working and lead in a way that's much more nuanced. So managers have now, since COVID and since lockdown remote working, having to learn how to manage in a nuanced way their workers who are all dealing with different individual personal calibrations of work-life issues, problems and balance. And so this is a whole new era for managers and leaders, and a great opportunity for them to train and become aware and to grow, develop professionally and personally. So it's pretty exciting. And so the shift of balance is happening now, that pandemics do reshape society at fundamental levels. And what this pandemic is doing is shifting the balance of power to the worker. So organisations are becoming increasingly aware that workers are demanding now, since they've had the benefits in many cases of work from home flexibility, are wanting much more flexibility to increase. And retaining staff, of course, is much more cost effective than losing staff. So organisations are now seeking to find from employees what it is they wish for this new world of work. And so it's rewritten the psychological contract between employers and employees in this way, that workers now want to be seen as humans, not just workers. And again, that's a good result from the pandemic. There is a great resignation predicted in March in Australia. And we've seen it sweep through the USA, of course, already, that more than 40% of the globe of workers are seeking to change their jobs and careers and leaving their employers in this year. And in Australia, it'll be next year. So this work burnout, which is such a serious problem, it's actually a breakdown in the relationship between the employer and the employee. So a good relationship between a worker and an organisation sees good engagement. A poor relationship, burnout. And so it's all about demands and resources. If we increase the demands on workers, but increase resources, you have high engagement. But if you increase the demands on workers and you don't give them the right resources, you have burnout. Working from home, lockdown fatigue, of course, have been predictors of burnout. The lack of boundaries. It's known as a slippery slope. So when I see workers starting to slip down the slope of burnout, it's time to start really helping them to self-regulate, to find resilience very quickly. These are the warning signs: exhaustion, cynicism, inefficacy. So an occasional exhaustion, occasional day of exhaustion, it's probably an overload in some area of our lives. But if it's happening more than once a week, it's a lack of balance and it really needs to be addressed. It can be through the job demands, it can be through intensity of work, again, dealing with the coalface of societal pressures that you're all often dealing with, or overtime, of course. It may be that we're not resting or recovering effectively enough. We're not getting regular sleep, exercise, play. Time away from work is where we recharge. And that's the important thing, that often organisations seek to help their employees recharge, but really it's away from work. So encouraging people to take time in lieu if they've taken a lot of overtime or spent a lot of overtime working. And if people are unable to recover, even while they're doing all of these great things to recharge, that's a major warning sign that something's out of balance. Something needs to change. And again, workers, individuals now seeing themselves as individuals and then workers are seeking more of this quality of life. In many cases, they've been able to find it during lockdown to recharge. And so another sense of burnout is when it's actually not possible to recharge because of organisational demands. So people who manage burnout successfully are the ones who succeed. Look at Barack Obama, 2 terms of presidency and he didn't burn out. Hillary Clinton did burn out. Good examples. So Australia has one of the largest overtime percentages in the world. In fact, we average 6 weeks of unpaid overtime a year, and we're in the bottom quarter for countries for work-life balance. And so organisations that help employees manage this are the most productive and avoid costly insurance claims. So what about resilience? Well, navigating this era of uncertainty and rolling change and crises requires us to be more resilient, more conscious of our resilience than ever before. And resilience really is now something that we can all share tools and collaborate and help each other to learn about. History and evolution's shown us that adaptability and resilience are in our natures. That's how we've evolved as humans. And by developing these skills, we can manage and even turn adversity into opportunity. by accepting the uncertainty, accepting it's here, finding agency, effectiveness, finding empowerment where we can, finding how to be adaptable and resilient, regaining the balance every time we lose it. That's so important. Finding what does make us happy and learning how to regulate ourselves to stay productive, managing mental health, seeking help as soon as we need to, and managing lockdown fatigues. So managing the fallout from work and relationships. As I said earlier, engagement, good employee engagement, good relationship with the organisation, and good resilience and good resources. Whereas with burnout, not a good relationship, not good resources, and probably not good resilience in the worker as well. Resilience is all about self-management, self-regulation, plus social competency. Being able to push back on a leader when you do need time in lieu, when you have spent a lot of overtime, being able to negotiate those things, social skills. Knowing ourselves is very much what self-regulation is about. If you know nature recharges you, make sure you get into nature. If you know sport does it for you, make sure you keep up your sport and make sure you are able to seek help. And this is very much what psychological safety is about. And that too came to the fore during COVID, which was a good thing, a benefit, that now organisations that are productive are really valuing psychological safety as part of their policy. So this is something that progressive organisations are doing, and I'm seeing individuals leaving organisations, leaving industries that aren't actually managing to help with psychological safety. So managers that provide this nuanced management as well will help with that psychological safety. And staying productive is now critical and more critical than ever before, because that is one area we can find agency in. If we're being productive, if we feel we're making a difference. Employee engagement has really come to the fore, as I said before, and a study in 2020, last year, in the middle of COVID, found that employee engagement increased in organisations that really paid attention to engagement by giving workers direct communication about what was going on, by sharing information, by trusting them, empowering them. And so we know that engagement is about loving and liking your work, actually being in charge, having vigour, dedication, in energy. And this has changed during COVID. People want more meaning in their work typically. They want to be more involved. They want to be more included. They want to be trusted. They want to be engaged and empowered and to feel safe and to avoid burnout. So the organisations that provide these resources that specifically individuals want, not what they think they want, but what they do want, and finding out what they do need, are going to be more profitable and more successful. It's proven to increase retention, productivity, and business outcomes. And people are wanting to job craft, career craft, manage their careers, move them in directions that they want to be going in, that's more meaningful for them as individuals now. And organisations that acknowledge and respect that will retain their staff. It's a very much an opportunity for us to grow and learn to develop as employees and as leaders. And so encouraging recovery time in our staff is important. Empowering leaders is important, supporting them, investing in them while they're learning these new skills. And so to wrap up, I guess feedback, support, strong support, but not micromanaging employees is critical as well. So let's focus on accepting the new challenges, finding more agency, empowerment, building better relationships with our staff, with our organisations, with our leaders, and take a moment to think about what helps you regulate yourself. Is it nature? Is it sport, play? Is it social? Thank you very much.
Thank you, Dr. Amanda, for joining us today and for such a great and insightful address. So lots of tips there for us to take on board. So thank you. So next up, we have with us Jane Monica Jones. Jane is a leading financial therapist, and she is a pioneer in the study of psychological and behavioural challenges with money, financial practices such as gambling, overt financial risk, retail therapy, overspending and under-earning. She has a passion for this sometimes challenging subject and works compassionately with clients and organisations to repair this relationship. She released her latest book, The Billionaire Buddha, in 2019, a culmination of 7 years' work, study, research in the field of financial therapy. Jane is the host of Financial Therapy, a podcast dedicated to the promotion and facilitation of economic empowerment for all. Also check this out for all her financial literacy, financial capability, and economic empowerment trainings. Welcome, Jane, and we look forward to your address.
Thank you, Melanie. I need to understand my self-sabotaging behaviours around money. I'm 40, I have a very high income, and I continue to have bad debts since I was 21 and have never had substantial savings. My partner and I have been married for 12 years, and our biggest fights are always about money. These are the narratives that I hear every day in my financial therapy practice. So who are these people? Well, they're not in financial crisis, people getting the wonderful support from financial counsellors that we saw in the bushfires. They are also not the cohort that we spoke about last week in Anti-Poverty Week, that have chronic and often intergenerational challenges with money. The people I work with are a big slab in the middle. They know about budgeting, they know about investments, and they range in age, stage, and have a lot and have a little. Now, what I see from working with these people is that money and mental health are an equalizer. It doesn't matter if you have a lot, and it doesn't matter if you have a little. The way it affects our mental health is exactly the same. More quotes from some of my clients. A 32-year-old doctor, I didn't know this kind of therapy existed. Thank God it does. A 53-year-old executive. I can't speak about this to anyone. I'm so glad I found you. The last comments, or all of the comments in fact, show how much shame and fear and vulnerability is coupled into this relationship with money. Shrouded in that is cultural narratives and social cues that say we can't openly talk about money, or I shouldn't talk about money, and levels of success and failure are pegged against how much we may have in our bank account. Now, these enduring social cues isolate us and tell us that openly sharing about money, and particularly our challenges, is dangerous territory to enter. So last week, I was fortunate enough to be featured in a newspaper talking about financial therapy. And I had 2,300% increase of traffic in my website, and I have been inundated with inquiries. Now, this response has highlighted that people want to talk about their money issues. More from my clients. I have good financial literacy, but I'm completely terrified by dealing with money. I don't know why, as I'm competent in other areas of my life. I have stacks of know-how about money, but it always feels like I have a heavy weight around me and I hate myself for it. Now, when we think about supporting people around finances, we often go to financial literacy, and that's an essential part of the solution. And in Australia, we're good at financial literacy and we're getting better. Government capability, financial capability strategy, resources like Money Start, lots of community organisations offering financial literacy programs, and of course the finance sector, which is leading with products and customer propositions about financial well-being. A bit more from my clients. I would like help with cutting back on my spending. I think my upbringing and background has a lot to do with the way I handle money. I've never been very good at managing money, and I'm a massive overspender. I get mental blocks every time I think about budgeting or getting control of it. And I have a huge inheritance that I think is making things worse. I don't want to spend in this way. Now, this is ordinary Australians and what's happening behind closed doors. Now, these narratives go beyond financial literacy. I am a great believer that people want a different type of support with finances. And it's important because the government can't afford us spending 64% of the money that we recently drew down in superannuation on gambling, clothing, furniture, restaurants, and alcohol in times of instability. This is from a report in August 2020 by the Ilian Report on Consumer Spending. Financial institutions can't afford people defaulting on loans, either can the economy. And our already overwhelmed mental health system is stretched beyond the need of the community. So This is where I see it as a great opportunity for the finance sector, this group that's come together today, to support colleagues, consumers, and the community in 3 very particular ways. That is creating cultural sensitivity, as Dr. Ferguson just mentioned, creating cultures that are psychologically sensitive and inclusive, because we know adversity happens, natural disaster, pandemics, and we also know that people sometimes don't get a great start in life as well. So language around that, mental health language, is adverse financial shock, such as job loss, bankruptcy, divorce, financial trauma, natural disasters, a death of a partner. These events affect people adversely for years and have severe impact on their financial well-being. We also need to, in that cultural and sensitive inclusiveness, we need to reinforce narratives that the work that Lifeline and Beyond Blue address every day, that financial well-being impacts our mental health and our mental health impacts our financial well-being. Number 2, take us beyond financial literacy. People want financial capability. This means integrating soft skills into financial capability, same that we do with our workforce in other areas. Self-agency, empowerment, problem solving, creativity, task, risk-taking, motivation, and resiliency. Now, this can be done through financial capability trainings with workforce and financial capability propositions for our customers. Number 3, more trauma-informed financial well-being policies and strategies. Now, the financial sector has been great in their response to people affected from the bushfire, their customers affected by bushfire, and pausing on home loan repayments for those in the pandemic. The financial sector has been also a great leader in financial hardship support for customers affected by domestic and family violence. But I'd like to see this policy of well-being, trauma-informed well-being, going to extending policies to minimize the traumatic impact of debt collection processes actually have on fellow Australians. Now, I want to finish by saying that every day I see people in tears about how they do money. Intelligent, regular people, completely undone by money. And we have all seen family and friends go through adverse financial experiences. It's truly heartbreaking. I want to live in a society that goes beyond the narrative that finance is just savings and budget, and that understand that this thing called money impacts our psychology and our mental health and our behaviors, and that our psychology, mental health, and behaviors affects our relationship with money. I want to say it again. It doesn't matter whether we have a lot or a little, the way this thing called money affects us is the same on our mental health. Again, it's poignantly illustrated by some words, again, from my clients. I always have fear of not having enough. That makes me feel frozen to do anything about it. And from another, I was born into immense privilege and I feel frozen and self-hatred because of it. Now, from all the support I've given to my clients around the years, I've seen phenomenal shifts on the way, not only they do in their financial situation, but in their overall well-being. And I believe together we can shift the narrative and create a society that is truly financially resilient and has better outcomes overall for its citizens. So thank you.
Thank you very much, Jane. It was a pleasure to have you and listen to you today, and really insightful and the profound effect on money. So we'll be heading to your podcast, definitely. So now it's my pleasure to introduce Jasmine Wolfe, Project Manager and from the Health Hub at CommBank and CBHS. So Jasmine Wolfe brings rigour, diligence and professionalism to the realm of health and wellness. A professional and qualified dietitian and health coach and practicing wellness consultant. Jasmine is part of the renowned Health Hub team at CommBank and CBHS. Her clients include almost 50,000 CBA group employees, contractors and their families. As a CBHS Wellness Project Manager, Jasmine creates and delivers original presentations on topics such as gut health, releasing stress, and the power of mindfulness, and how to boost energy levels and nutritional tips on eating well to curb your cravings. Passionate about her goal to help people live healthier and happier lives, Jasmine also provides one-on-one health coaching consultations and facilitates regular guided meditation sessions. Welcome, Jasmine. I'm looking forward to your address, followed by a short, small meditation. Thank you.
Thank you so much for having me here today. It's an absolute pleasure. Now, we tend to experience stress every single day of our lives, and sometimes that level of stress is big, and sometimes it is small stress. But either way, stress over time and ongoing can leave us feeling overwhelmed and exhausted. And we all know that stress can have a detrimental impact on both our physical and our mental health. And that's why it's really important to check in with ourselves and to make changes in our lives to support our health and well-being through good times and times of stress. And especially within the finance industry, there is high levels of stress. And it's fantastic when, as an industry, we can care for our employees and their mental health. So over the next 10 minutes, we'll be exploring what stress is, how it affects both our physical and mental health. And then we will discuss how meditation can help with this, how it can reduce our stress levels. And we'll get to do a meditation here together today. Everything that I do discuss is for general information purposes only and does not replace information from your qualified healthcare professional. So let's take a moment here to check in. On a scale of 1 to 10, rate your current stress levels. 10 being you are stressed out to the max right now, and 1 being you are completely chilled. Just taking this moment to notice and check in. And the reason why it's fantastic to check in with our stress levels regularly is because that puts the power back in our court of, okay, I'm really stressed right now. What can I do to support myself during this time? Who can I ask for help? Who can I reach out to during this time? And probably a great place to start here as well would be, what is stress? So on the next slide, stress is really tension. It can be from internal factors, it can be from external factors. And that stress can leave us feeling overwhelmed. I like to view stress in terms of macro and micro stresses. Macro stresses are those big things in life. Maybe it is financial struggles. Maybe it's losing your job, having to move house unexpectedly, issues with health. Even COVID has been a macro stress for a lot of us for quite a while now. And those macro stresses set our start point at a certain level, which then our micro stresses build from. Maybe you sleep through your alarm, the kids are not wanting to go to school today, someone cuts you off in traffic, the emails are piling into your inbox, a project that you thought you had 2 weeks on now needs to be finished by the end of today. And the stress levels are rising, rising, rising until you are reaching those max levels. And if you already have some macro stresses in your life that are setting you at this point, it can be really easy to reach those max levels of stress. And that's why it's very important to check in with what are our main stresses in life. And is there something that I can do to change those stresses? And the reason why stress is even something that we discuss is because stress has a huge impact on both our physical and mental health. On the next slide, you can see that when we are stressed, our heart rate and our blood pressure increase. Our blood sugar levels start to rise as well. Those stress hormones start pumping around our body. We can get gut symptoms, and even our breath changes and starts to be quick and shallow breaths. And this has an impact on our mind, our ability to focus, our energy levels, our mood. And in the long term, this stress ongoing can lead to an increased risk of chronic diseases, but also poor mental health. And that's why we need to look at ways that we can manage our stress levels in life. And one fantastic way to do this is through meditation. Now, did you know that meditation can actually change the makeup of your brain? Over time, meditation can reduce the areas of your brain that is involved in your stress and fear response. And it can increase the areas of your brain that are involved in problem solving, memory, learning. And isn't that incredible? That over time with meditation, when challenging situations in life arise, rather than reacting from a place of stress and fear, we are able to respond from a place of problem solving. That's incredible that it can actually change the way that you respond to challenging situations in life. And of course, it also brings down the heart rate and brings down the blood pressure as well, as we just found increases when we are stressed. So it's incredible that it can really switch up how we are feeling. And that's why we are going to do a meditation together today. This meditation is going to help you to reset. It's going to help bring down those stress levels and help you to feel even better for today. So just find your comfortable seated position of choice. We're going to change to a slide, a view of the lake that I share when I run these meditations with the employees at Commonwealth Bank. And just find your comfortable seated position of choice. Take a deep breath in through the nose and a slow exhale out through the mouth. And slowly lower your gaze or close your eyes. Take a moment here to take in your surroundings, noticing any sounds that you hear around you. And noticing where your body connects with the surface beneath you. Through your chair, through your feet touching the ground. Continue to draw your awareness further into your body. And starting from the crown of your head, slowly scan down through your body. Noticing any sensations you may be feeling, or any tension you may be holding on to. Taking this time to check in with yourself. And when you do find pockets of tension in your body, pause there for a moment and take a deep breath, sending the air to those pockets of tension. And as you breathe out, feel your body start to soften and relax. And continuing to scan down through your body from the crown of your head all the way down to your toes. And then bringing your awareness to your breath. Start to notice the movement of air through your body. You might notice a gentle breeze by your nostrils, the expansion and contraction of your lungs with each breath, or the gentle rise and fall of your belly. See if you can notice where you feel the breath the strongest, and focus your awareness here for a few rounds of breath. And then slowly releasing the focus on the breath. Start to bring your awareness back into your surroundings. Noticing where your body connects with the surface beneath you and feeling the support. Invite some movement back into your body now. You might like to wiggle your fingers and toes or roll your shoulders back and down. Take another deep breath in through the nose and a slow exhale out through the mouth. Slowly blink your eyes open again. Meditation can be such a fantastic way to reset and bring down those stress levels. It's such a great way to support our mental health. And just to wrap up from my segment of today's program, we all experience stress. It is a normal part of life. But in the long term, it can impact both our physical and mental health, as you can see here on the next slide. And that's why it is important that as individuals, we are proactive in putting things into our life to support our mental and physical health. Especially meditation can help. But also as companies and businesses caring for the well-being of our employees and putting services in place that they can access to support their physical and mental health. So before we finish up, how will you stress less today? What will you do in your life to support your physical and mental health? If you want, share it in the chat box. I would love to see. And I want to say thank you very much.
Thank you very much, Jasmine. That was very relaxing and great takeaways, and I will be thinking about what to do to stress less. So thank you very much. I'd now like to introduce Matthew Jackman, Global Shaper Alumni, World Economic Forum. Matthew lives with bipolar affective disorder and complex post-traumatic distress disorder, and is a sibling caregiver to a younger brother and sister who live with enduring psychosocial diverse abilities and has lost their mother due to suicide, and consequently grandparents due to stigma. Matthew's experiences of distress and service use drive his passion for global social change in mental health. Matthew is a global mental health advocate promoting human rights, social justice, and lived experience as an academic science from public health and mad studies disciplines. Matthew is also the recipient of the Mental Health Advocate of the Year Award in 2020. Please join me in welcoming Matthew Jackson for their address.
Thank you for that, Malini. And yeah, really been enjoying the presentation so far. And yeah, feeling very relaxed after that, very centered and present after that meditation. Thanks for the lead in. Yeah, so today my presentation topic is really less so about the individualization of mental health and finance and more about the critical social and structural determinants that shape poverty and create that as a significant social and structural risk for people in our mental health service system. So as mentioned, I'm a person with lived experience or living experience. I haven't died. I'm a service user and have been a service user of many different financial services, including financial counselling myself, and experienced quite significant suicide risk as a result of being in debt of $60,000 when I had lost 2 jobs when I was unwell. So the talk is really framed around, the personal being political, as I say in feminism, and really linking, my experience with collective struggle and unequal and unjust systems that are really framed and designed to keep people entrenched in poverty within the mental health service setting. I think it's important to address, the critical and political analysis and discourse of finances and mental health, and that really includes that the system is corrupt itself and centred around macroeconomies, around biopsychiatry and big pharmaceutical industries, monetising people's distress and entrenching them as a result of funding services from government. It's important to also mention that the current models that we have often operate on charity and doing things for people rather than providing space for self-determination and empowerment and autonomy. And as long as we continue to have those systems, which really are just to pay attention to unjust service systems, we won't see change at that broader structural level as a society, not just in Australia. It's also important to mention that, we do need systems change in this space. We need those inside advocates. And I know you mentioned I'm a global mental health advocate. I'm more of an activist than an advocate. I kick, scream and yell and get dragged through the mud because that's where I'm comfortable and situated. It enables me to have a voice. Working for government usually doesn't enable you to have a voice and speak truth to power. So I'm a mad academic, a mad identifying academic, and I use the term mad to subvert psychiatric discourse and medical discourse. I do a number of things. I run a peer-run organisation, the Australian Centre for Lived Experience, and I have a number of living experience students, social work students, and we run community activism around anti-Satanism campaigning and lots of community events. Well, we're certainly intending to anyway. But for this talk, I really wanted to share with you a really important seminal article because I think, knowledge is power, and I think it's important that we improve our literacy in this area because we often don't get told the truth. And that's because we exist in these white colonial Western patriarchal societies that reinforce and perpetuate oppression and are designed to keep people locked in disadvantage. So this article, I want to read from the abstract, and it really speaks to a lot of service users defining poverty as a disease, as an illness, and being kept in that as contributing to their mental health issues rather than the other way around. So it's called The Psychiatrisation of Poverty, or the Medicalisation of Poverty, by China Mills, which was published in 2015. So I just want to read from it, and then I'll conclude with a few key points, I guess, in moving forward and how we kind of structure and agitate oppressive institutions in society that entrench us in disadvantage. So there's a positive association between mental illness and poverty as one of the most well-established psychiatric epidemiology in the world. However, there's little conclusive evidence about the nature of this relationship. A lot of explanations really revolve around the idea of a vicious cycle where poverty may cause mental ill health or mental ill health may lead to poverty. However, problematically, a lot of that literature and research actually overlooks the historical, the social, the political, and the cultural trajectories and constructions of both poverty and mental illness, or emotional distress and vulnerability, which is how we frame it in the social work and peer world. We don't view things diagnostically, and we don't pathologize people's human experiences of oppression. Laudable attempts have really been designed to explore the social determinants of mental health, and we all kind of get it, now with COVID, like, oh my God, the environment impacts our mental health. No, like housing, education, employment, access to services, shock horror. So we get it. We all are on the same page regarding the importance of social determinants. What's lacking is the economic and political determinants, the structural determinants and analysis. So some of those social determinants in mental health really sometimes take recourse to using and reifying different psychiatric diagnostic categories, which really individualise people's distress and work to psychiatrically sort of reconfigure their symptoms of oppression, poverty and inequality as symptoms of mental illness. So the system is designed to pathologise people's experiences. There's no pill for poverty, there's no pill for racism. These are social and structural determinants that need to be dismantled, which raises really a paradoxical issue that the very tools that are used even in research to understand the relationship between mental health and poverty may prevent recognition of the complexity in that relationship. So when we look at the mental health and poverty nexus through that psychiatrisation or medicalisation of people's human suffering, this particular paper that I'm reading from really recognises the need for radically different tools to trace the messiness of different relationships between mental health and poverty. What's causation, what's symptom, how's it interacting and interplaying. It also really implies a radically different, way of intervening in mental health and poverty, and requires a radical reshift in how we have equal or equitable, just societies, that challenge all those oppressions of racism, sexism, homophobia, saneism. We don't even talk about saneism in mental health, which is ableism. You're mad, you're crazy, you're an idiot, you're an imbecile. These are all derogatory words used to, designed to other and categorize people in the asylum institutional era as people that were less than. Idiot, imbecile, they were intellectual disability categorizations for children at different developmental stages. So we need to improve our literacy in this space and call it out like we call out homophobia, sexism and racism, because they all intersect with poverty and financial health. It also implies a radically different, it also sort of recognises the different landscapes in which our lived realities of poverty are embedded. So we need to better understand how the political economy and the corruption in psychiatry, impact psychiatric diagnostic and prescribing practices. When you go to a GP, you don't get assessed or measured for your neurotransmitter levels, you just get dished out pills. Whereas, diabetes, you get your blood tested. The system doesn't make any sense, and we are shifting slowly towards a more social and structural discourse and analysis within mental health, which really is shaped around our ability to have financial health and well-being. So just a few comments from service users in this paper. One of them described poverty as pain. It feels like a disease. That's pretty powerful. Another person described it, poverty takes away your desire to live. Another said, poverty is when a person goes mad and wishes to commit suicide. So these are comments, qualitative comments from service users. So just in wrapping up my little, elevator pitch and hopefully thought-provoking pieces, I wanted to conclude on a few, ways forward, so 3 ways forward. How do we move through the nexus of poverty and mental health and the corruption within the system of monetising people's distress for the sake of professional associations and disciplines, for the sake of funding mental health systems that don't work? Throwing psychiatrists into Zimbabwe, that's not going to work. It's a white colonial system that doesn't even work in Australia. So some ways forward are really to help mobilise the MAD movement, people that deem themselves mad, which include consumers, service users, survivors, ex-patients. So they're all labels that we use to categorise ourselves depending on our experience of the mental health service system. And I, as I mentioned, use MAD to subvert that psychiatric discourse. So we need to help mobilise that movement like we have in feminism, Black Lives Matter. Part of that is also social justice movement building and ecological justice movement building, where we combine social movements and throw power at these really oppressive institutions that are centred predominantly around, white, heterosexual, upper class, able-bodied, able-minded men that like to mansplain throughout the world. And there are a few good ones, but a lot of them like to mansplain. And are quite happy to reinforce the privilege that they have. The last point I wanted to make was just that we need to centre living experience, and we have an epistemic injustice. So epistemology being the construction of knowledge, the privileging of some knowledge over others. And we, in a Western white, patriarchal society, colonial society, we privilege medicine and the law as the predominant, hierarchical disciplines of knowledge. We need to challenge that as an epistemic injustice, and we need to re-attention power to all the other knowledge bases which have equally the same, if not more, credence within the mental health system: social sciences, Indigenous sciences, cultural studies, political studies, spirituality, and then, of course, living experiences at the bottom of the pile of recovery. So as long as we continue to see the interplay in service systems where people turn to the doctor, they turn to the lawyer for power and decision making. As long as we keep seeing that, the system won't change. So we need a radical reshift, a philosophical reshift in research and privileging science and what we know and define as science as well. So these are big, massive concepts, and the system is completely corrupt, and it's important that people start speaking out. And unfortunately, there's not, a lot of people don't get paid to do activism, which is why it's so hard to dismantle systems. Government doesn't pay for you to agitate against it. So it's important that there's people like, you know, you and I, to social justice movement build and do community activism in the community. Thank you.
Thank you, Matthew, for joining us today. And it was a delight to listen to you and your passion, and look forward to hearing more in the Q&A session. So moving on to today's agenda, I'm delighted to invite back all of our speakers from today's panel for a discussion. So firstly, Dr. Amanda Ferguson, Jane Monica Jones, Jasmine Wolfe, Matthew Jackman, and additionally, we have Meena Vagish from ANZ Bank. Meena is a senior executive working with ANZ for the last 15 years in management roles for the last 25 years. Meena's passion is growing and developing people selflessly, which she has been very proud about. She has worked in different parts of the world, like Africa, New Zealand, India, Australia, with people from different backgrounds and cultures, which has made her a better person. Being in banking frontline, she also sees the good, the bad, and the ugly. It also gives her an immense satisfaction as a banker, assisting her customers by completing a financial health check, by understanding the holistic financial situation of a customer and helping them achieve their goals and their dreams. She goes on a journey with her customers and also loves to help community organisations grow and support the communities. So firstly, I'll start with a question for anyone, really. So how can one approach their colleague, family member and friend about their mental health whose behaviour has changed because of a financial struggle? So obviously in COVID, I'm talking about COVID and financial recovery, people's behaviours would have changed. So how do you approach them and what do you do given that there's the stigma around mental health? So just opening up to the floor.
I'm happy to jump in and say we need to be sensitive to the ways they prefer to communicate. Some people are very private and won't want to talk to their family members or friends, in which case directing them to a GP, even if it's on the pretense of a general health, and notifying the GP if the GP will let you. And often you can just send a message through their receptionist.
Sure. Anyone else? No?
I'll jump in on that one. Look, Are You Okay is a really great resource to get some ideas on how to approach. You know, mental health is still, although there's a great amount of work that's been done in this field, it's still very sensitive. And part of that is maybe understanding that we need to have a certain level of presence and safety in ourselves, as Dr. Ferguson has said, and also too that we have a limitation. This is, sometimes we can't reach that. So, I mean, as a really great, easy resource, go and have a Are You Okay is a good one. Beyond Blue. There's a lot of services out there that can really help and support how we can, you know, manage our college, or, you know, support and manage our colleges, our colleagues, friends, and the community generally.
Sure. So another question. So obviously, COVID has really impacted the mental health, and probably we won't see the impacts of mental health for a long time. So I think it's going to be a long tail. So how do, and so people are starting, lockdown's finished and people are starting to transition back to work. So managers will need to support their teams. So have you got any tips on how managers, given that their teams are coming back together for the first time, how will they, or how can they support their teams in terms of their mental health and ongoing, and what should they look out for?
I can go. So basically I lead a team, and for us, especially in the finance sector, what we're talking about is empathy, you know, being empathetic, knowing what's been happening around us, knowing that people have been locked in, you know, any situation you want to address, keep that in mind, that empathetic, and go down the track of like, how are you? Like as Jane said, or even Amanda in her, conversation earlier, I heard that, you know, being mindful, being, empathetic, and understanding about how, what is their feeling, how are they feeling, any behavior changes, everything, you know. So trying to just be empathetic and not micromanage is something which I have, you know, during this whole pandemic, or, You know, even previously, to be honest, I don't micromanage. Having the trust and faith in your team, you know, and believing in them is how I would approach this. Yeah.
And I think also managers leading by example as well, having those healthy boundaries in place to support mental and physical health, and making sure that your teams are aware of what services are available in your workplace and externally from your workplace. Keeping those conversations open around those things, and leading the team. So setting up events that you can improve mental and physical health, having conversations around that and being really open and honest is a fantastic way to care for your team and their mental health.
And so I think that in the finance industry, there's always a lot of pressure and a lot of pressure to deliver and just go, go, go. And so how do we make managers understand that taking a little time for their teams for mental health would be productive in the long run, and that their team members will manage and be more productive and give more? So is there any tips? Because I think that sometimes they think, okay, well, taking half an hour for a walk or half an hour for meditation is going to detract from their delivery, or they're going to be distracted, or that's just not going to get them their KPIs. So is there any tips to make managers see that a little bit of time spent on their mental health would be better in the long run?
Like even having a Friday, you know, like if you're normally having a Friday meeting for half an hour, just take them out for a walk. If it's especially now coming into summer and things are opening up, just go out for a walk close by, or do some team building exercises, you know, just sit and relax. Or even a Friday evening, like a drink thing at work, you know, just sit down with a little bit of nibbles and something and just share what's been happening, what you're going to do in the weekend. Just that nice, you know, bonding, rebuilding. Again, rebuilding, rebonding is what I think we've tried to do as a group within ANZ as well now. Yeah.
I think that we need to look at cultural changes. You know, most organizations, a lot of organizations in Australia, and we work for them, have that shareholdering is our main stakeholder, and that productivity is high. But there is, of course, a lot of research that says that people need rest. And that's been the great narrative, I think, coming out, that productivity happens when people are rested and resourced. So this is a cultural thing, and that needs to be trickled down from CEOs, and that our whole working environment. In a way, I really think that the pandemic has been a fabulous reset for people, just to, you know, pull the focus onto, actually, these are individuals, these are people that we're all, you know, kind of in this together. I know that was a bit of a cliche comment, but yeah, so that's been a good thing, but it needs to be that cultural thing. We need to shift, just as Matthew had said, that, you know, shifting priorities, you know, shifting narratives around what is the most important for us as humans. And that structure it happens in company structures, but it also needs to be a narrative that we take out and say, you know what, who's the most important here, humans or the stock price, you know?
And I'm picking up on that point. So the human element is extremely important, and sometimes there's a stigma around mental health, but people with lived experience can share their journey, and then people can relate to them and feel like they're not alone. So Matthew, you touched on the importance of sharing living experience and sharing the stories. How do you best recommend that we do that, so that dialogue is like elevated and becomes front of mind for people, and so people can feel like they can talk, and there's no so much stigma?
Well, I think I'll continue to bring the political analysis and discourse to this conversation, because it's capitalism and neoliberalism that's the problem. You know, the individualization of people and the decentering of community and society, particularly in white Western colonial patriarchal societies, is extremely problematic. You know, increasing suicide rates. The world is dying. We're all dying with it. You know, and this is as a result of human beings the fallacy of falling into greed rather than our own, human well-being and welfare. So on the ground, what does that look like? To Jane's point, it's absolutely cultural. And it's hard for organisations not to take in that capitalistic neoliberal framework because it's centred around politics, it's centred around legislation. And it's centered around, societal ideology and attitudes towards, what work looks like. And we've fortunately, the silver lining of COVID is that, as we've seen in history and time, it's always great social global crisis that makes structural change, along with social movements like feminism. So we need a combination of continue the global crises, please, and social movement building, because that's what will change on the ground. And to speak to the individualist point, like as an employee in the workplace, unfortunately, I've worked in government departments where I've been sacked for entering a hypomanic episode because I'd fallen asleep, in the afternoon and was on a new antidepressant that, basically knocked me out. And that was Friday, and on the Monday I was asked to leave. So government is a highly government and higher education in particular, capitalism is absolutely rife, and it's extremely insecure work, and most of it is contracted now, and we're paid on a casual hourly basis. So you can be working one day and be sacked the next. So again, these are all, spaces aren't safe. So you really need to just trust your leader, but I would encourage you not to disclose if you don't feel like it's a safe space. And if you feel like it is, disclose. But unfortunately, saneism and ableism is absolutely rife in the employment sector because within a capitalist and neoliberalist framework, your productivity is valued more than your human welfare.
So yeah, that cultural shift is very important, and I think leaders need to create an environment where everyone can bring their whole selves to work. So a couple of practical questions. So seeing a financial counsellor is expensive. So when someone is really struggling with their finances, what are their options?
First of all, they need to approach their bank as well, and we can sit down, like, for example, with an ANZ, we do called A to Z review. We sit down and understand the customer's holistic financial situation and to see where they're at, where they would like to be, and where they would like to, what's happening current situation, and we try and understand the holistic situation of their financial and well-being. And then if there's something we can help, great, we will definitely help them. Or we have places where we can direct them to, like we've got Money Smart, we've got Hardship Team. If they're struggling with an ANZ, we can get them to, to the right people to see how we can assist them first, and then I think it'll come to someone like Jane, financial counselors, and to support them. Yeah.
So I just get that really clear. Financial advisors, what you were saying is expensive. Financial counselling, anyone in Australia can go and see a financial counsellor. You can turn up to, and there's plenty of care. You go onto the National Debt Line is a way to get in, but just search financial counsellor. That is absolutely free for everybody in Australia. Doesn't matter your financial situation. Financial therapist, I'm in private practice, so that of course is paid. But just to get that, I wanted to get that very clear distinction, as well as working with your bank. Centrelink also offer financial advice as well, if that is something that people get. I just wanted to kind of clear that up. Thank you.
Awesome. And Matthew?
Yeah, as someone that uses and has used these services, I was acutely suicidal for 6 months and in $60,000 of debt. So the Commonwealth Bank have wiped that as a result of my circumstances and working with a financial counsellor over 12 months. So that was a very useful service. Obviously, there's a sliding scale for accessing free services in terms of your income, but highly encourage anyone in financial distress who's lost their job as a result of mental health to absolutely access the National Debt Helpline. And banks are usually quite compassionate, actually.
Just on that point, so the question here, how can we identify if someone is overspending due to a mental health episode or a manic episode? So is that something that you can identify, or
we can do that in the bank. When we see a customer comes into the bank and we are doing the financial health check, we go through their transaction history, we look at where they're spending, what's happening, and we do question them, what's happening, talk to me about it, how can we help, you know? And then if we see there's a pattern where someone's gambling or someone's, you know, things are happening, or they are really struggling with their finances, you know, definitely we will be able to help. And I strongly say, first reach out to the bank, you know, to see if we can help. And then, because there are so many options we can, you know, suggest, or, you know, even sometimes someone will have a home loan. If they don't approach the bank, like the bank has so many customers, we try our best to approach, to make calls, to reach out to customers and say, come and review your interest rates, come and review your banking. But not everyone, you know, we can't get hold of everyone. So it's every 6 monthly, at least, check is what I would say, a financial health check.
Yeah. So I think that, yeah, same with CBA, like people think that the bank is not going to help them when they're in times of trouble. So we do have teams to help with domestic and family violence, with financial hardship, with gambling, etc. So yeah,
vulnerable customers, you know.
Exactly. Yeah. So just in terms of how can one strike a balance between saving and living a good lifestyle? So what does money smart actually look like? And is it smart to have an emergency fund? So that's a bit of a three-pronged question, but any thoughts on how can you strike that balance? Like everyone's like, oh, you need to save, but then you don't, or you need to buy a house, but then you have a mortgage, so you can't go on holiday. So how do you strike that balance?
Yeah, look, this is what I mean, you know, I'm again working from the mental health background, and this is the balance that people are constantly battling with. For me, I'm always about resourcing and rest and things that give us a lot of, I mean, because we work hard, we all work hard, or, you know, I mean, work hard at our families and we work hard at our lives. We need to have a little bit of joy and play. Now that joy and play is one of the foundations of making us more resilient, making this nervous system more resilient. And so for me, it's almost a priority. I often work with people that have a very difficult relationship with being able to play with money. And because of this pressure of, you know, I've got to hit the mortgage, I've got to hit everything at work and everything like that. But we've also seen that this resource of play, of fun, creativity is actually so resourcing for our nervous system, and that it gives us a better capacity to do everything that we've got to do. That's my suggestion, and that's my financial well-being strategies is play. Enjoyment has to be part of it.
And also just is there a link between financial difficulties, gambling and mental health? Does one come before the other?
Yeah, what we do know is that some of the parts of the brain that deal in reward is dopamine. Now, when people that have been born into issues of trauma or have had adverse experiences will often have low levels of dopamine. Dopamine is really great for motivation. And once we achieve a goal, we then want to repeat that. Now, how do we get dopamine, endorphins? By connecting with nature, by doing a lot of, you know, things that actually give us a lot of joy. And this builds that resilient brain, resilient nervous system that are the great chemicals that we need to actually be able to have stickability, capacity to do the things that we need to do in our life. So it's all kind of in the brain chemical. And when we've had adverse experiences, when we've you know, had trauma of you know, loss, those levels in our brain go down. And so it's about trying to bring those back up so that we have that longevity of resilience in our life that makes us feel that I've got an internal resource that I can always go back to, which is my own, you know, built-in strength and capacity that's in there in my body. Yeah.
Did anyone want to add on to that?
Well, picking up on what you're saying, Jane, about nature, science often, as we know, catches up with what we all kind of figure out for ourselves, that nature, now green and blue nature, are so restorative. Blue more than green, but if you can get green nature, you know, it's so restorative.
So just in terms of going back to work, any advice on managing staff who don't want to take the vaccine and are at risk of losing their jobs, and managing the team that they're part of? Any ideas? No?
Wow, that's a toughie. And I think the fact that we're all gone kind of a bit silent is it's a really challenging question. Look, I think there's going to be, for me, I think, you know, because I see this one as well, people are kind of devastated that I can't have a sovereign choice around my body. And yet, you know, I've been kind of corralled into the financial obligations and limitations that I have. I think we all have to get a bit courageous and say, you know what, we have to kind of fight for people's right to have choice, because this is what sovereignty and equality and means for us. And that we can also, you know, be flexible in our culture to say, hey, let's try and hold everyone. Let's not leave anyone behind. And this is, I think, what Matthew is saying as well, is that we often say there is one paradigm and everyone has to fit into that. And it just, if you can't fit in that, and that's what I see every day, I can't do money, but I'm really intelligent, you know? We need to have a capacity to bring everybody in. And that becomes, that's a capacity that we as individuals, not just workers, not just workforce, but community members, to say, where am I, you know, doing a very thin line? I mean, that's the only thing I can see as a place that we can actually just sort of say, you know what, vive la différence, you know. We've got to have that as a society.
Yeah. Anyone, any other comments? No.
The only thing I would say is I think some employers might be able to, you know, accommodate them in a role which they can, you know, like work from home or something. So, for example, if it's a staff member who normally works in the branch and due to whatever the reason is that they don't want to take the vaccine or they can't take the vaccine, look, they might, if it's a bigger organization, if we can, and their skill set can accommodate another area of the business where we can, you know, help them to stay in the job, because again, it's their health and everyone's health around them is what we need to keep in mind. So I think some employers are looking at that option as well.
Okay, so Jasmine, you are a dietitian also, and you look after holistic health. So how important is holistic health in terms of mental health?
Absolutely important. They're all your pillars of well-being, and what we eat fuels our mental health, and how we move our body fuels our mental health. And there is so much science and evidence backing that food and exercise and all of those lifestyle aspects are closely connected to our mental health. And I believe that quite often we, within our medical systems, we look at just the little individual areas rather than looking at someone as a whole person and their whole life. So yeah, nutrition, exercise, well-being, they're the things that I'm passionate about, and that preventative health space, rather than waiting till things get really bad, being proactive in the preventative health space is the best place to be.
Mm-hmm.
Yeah, if I can just build upon that,
Yes,
I think again it speaks to epistemic injustice. There's a privileging of knowledge in society, and that's, you know, biology. Yeah, it's usually the natural sciences. So what happens is everyone's trained in their expertise. You know, sociology and, you know, anthropology, or in the medical system, it's, you know, medicine, psychology, psychiatric nursing, occupational therapy, social work, peer work. They're the primary disciplines. And everyone gets it, they're all kind of valued, but they're not institutionally, and because there's power in particular decision makers. So things like nutrition and dietetics also get shelved to the side. They don't get, you know, they don't get appropriately funded. You know, music and art therapy, great for people with mental health issues. Do they get funded? No. Usually the disciplines that get funded are the ones that make money, hence why the system being corrupt. So that's, you know, the diagnostic model is all about really, you know, access for people, and it's about making money, and it's about monetizing the system around medication. And we know that medication is just a band-aid, but a lot of the allied health spaces, you know, have excellent evidence base, but are still, you know, not privileged because of the monetization of this unjust system of knowledge. And hey, you know, Indigenous people have been living for hundreds, you know, 40,000 years. So they're doing something right, but why do we privilege their knowledge?
Food for thought. Amanda, did you?
Yeah, I'm just picking up on what Matthew and Jasmine are saying in terms of this sort of mass exodus we're going to be seeing in March, that along with personal changes and value systems that people have reassessed, and I've seen a lot of that from my individuals in private practice, that, you know, they had time to consider their health again and maybe, you know, change the way they were looking after their health, and that whole being, well-being kind of that Jane and Jasmine are talking about approach. They were able to expand their mind, some of them, to consider all of that. And you know, hopefully, Matthew, there will be more of an individual kind of push for change, as well as that sort of wish to job craft and career craft that we're going to see with this great resignation. Surely there'll be individuation, empowerment, I hope. You know, and I know that, you know, a lot of organisations pay lip service to these things, as you say, but they're going to apparently have to value their employees a lot more, or they're going to lose economically, and they're at risk of, you know, major insurance claims. And if you listen to my podcast on burnout, I deal with insurance claims, workers' comp problems from burnout all the time, and corporations, you know, are running great risk now that burnout's on the rise. So hopefully individual power will be something we start to see.
I am starting to see such a significant shift over the last couple of years of shift on that individual basis, but also the organizational basis as well. From health and well-being was kind of that something off in the distance that we sometimes engaged with once a year just to tick that box of I cared for the health and well-being of my team. But now I'm actually seeing people engaging with it more often and shifting that perspective and realizing that it is important and that we can't be productive and successful at work if those things are completely neglected. So it is really exciting to see it shifting. And I hope that as things get better COVID-wise, hopefully we still continue on this path of going, what is actually important and how can we care for ourselves, our teams, our organization, our population, because it's really exciting seeing it moving in that direction. And I'd love to see it to continue to grow.
Actually, Safe Workers New South Wales just mandated psychological safety. So we usually see a flow-on effect to other states. And again, a lot of organisations will pay lip service to this, but there are going to be some that are, progressive and are going to really recognise that if they don't have a policy of psych safety, including the burnout, including all the other health issues of fun and play that, you know, Jane's saying as well, that and recharge, then it's going to cost them. So hopefully we'll see change.
Hopefully. So on that topic of change, so a lot of, as Amanda said, a lot of people are looking at COVID as more of an opportunity to create change or to move forward. So what are some, in terms of finances, what are some small changes that people can make, some practical things that they can do if they haven't really looked at their or haven't really paid attention and not really sure of what to do to progress? Any tips?
I just noticed something in the chat that said about financial boundaries.
Yes.
So often that is something that I come up against. And when we do find it, when I work with organizations or, you know, employees of organizations, we look at boundaries as one of the things, you know, financial boundaries particularly. Now, we don't get taught, and this is in the soft skills area, we don't get really taught how to put on boundaries in our life, and limitation is something that we often don't learn either. So that is interpersonal relationship skills that need to be learned, to say, how am I with a boundary? And then how am I with my limitation? because we run over our own limitations when we overspend or we gamble. So these two things we never really get taught as life skills. And this is where I often work with. It actually has a lot to do with our upbringing, that we don't get, how do I say, no, no, you can't keep borrowing money. And we are getting there's some really great resources out there, particularly You, Me and Money for young adults coming into relationship and money. We're looking at narrative around what financial abuse looks at, which is a total running over people's boundaries. So there is lots of talk around what's this financial boundary stuff. And it has a lot to do with the capacity for us to say, no, that's not right. Limitation. We often, again, it's part of that brain piece where, I'm feeling a bit low. I want to kind of get a bit of a happy high. For me, for retail therapy is a bit of a pathology. I want to feel it a little bit. So it's about learning capacity to actually set a limitation for myself. You know what? I have limited cash. I've got certain obligations, and I need to find or get support with, whether it's like, doing financial capability programs in my workplace. How do I allow myself to learn about the limitations that I have in time, energy, and rather than running that over. So I think those they're soft skills that we often, we do it in other ways, but we can also pull that language and those ways of working in our relationship with money.
And you did touch on their financial abuse. So there's an increased prevalence of financial abuse. We've seen it at work in terms of people calling in on our community wellbeing team line about, just people have been in isolation with a perpetrator, so financial abuse. What are the signs, and what can be done for women or anyone to, recognize that they are in a financial abusive situation?
Yeah, I'm happy to answer that. Sorry about this. Okay, so controlling of our funds is one of the big things that if you have no access to the actual funds in the household. Controlling of time, limiting your capacity to go and earn is part of that. So that if you can't go and work anywhere, yep, great. Matthew has put that up. Also about limiting access to study to improve our capacity to earn is part of that financial abuse, as well as running over people's boundaries around money, constantly asking for money, access to bank accounts. All of these things, there's some great resources out there. If you're working with the public, really get people informed about what are those boundaries and limitations people have, a right to work, right to have access to money, right to have a way to improve their economic situation.
Sure. So, did anyone else have anything to add? Yes,
I was just going to say, I think, again, intersectionality, I think it's important to recognize that, people that experience layers of oppression, women, culturally diverse people that don't have citizenship are at particularly high risk in patriarchal communities and cultures, are at particularly high risk of financial abuse. And I think that's really important for, me as a, white, male identifying anyway, even if I'm non-binary, it's important for me to illuminate that, for us to all be cued in as a society and develop that literacy that, abuse and neglect and violence is centered around power. So they're particular groups that are really susceptible. And I say that as a social worker who's worked in the space for a long time.
Yeah,
Matthew, we've got yes.
Sorry.
No, go ahead.
Just as Jane was saying, that money problems don't discriminate socially, nor does, of course, domestic violence. I might deal with quite a privileged section of society with my patients, but domestic violence is very, very common.
Yeah.
And it includes that financial abuse, of course.
Yeah. I think that money should be talked about right from when we're young. It should be taught, and it should be those techniques, and also for people starting work. So Matthew, I've got a question for you. What is your top recommendation for young people starting work when it comes to finances?
Yeah, well, I grew up with my dad, who was bankrupt 3 times, and grew up in a single parent household in public housing. So I'm kind of what Jane was talking about, you know, like someone that just grew up with no financial literacy whatsoever and ended up in a lot of debt because I didn't know how to manage money. I never budgeted. I mean, I still kind of live my life off the skin of my teeth and just enjoy it. You only live once, quite frankly, and who can afford a home anyway anymore? So I think in terms of, it's just about, I think it all starts with awareness, like anything, I think. So keeping track of your bank statements, seeing what you're spending is really important, and be structured around having a plan, a budgeting plan, you know, whether that's different pots of money that you're putting your income into, and chat to mentors, you know, gain either formal support through, you know, a financial counselor or financial therapist, or, you know, a mentor that knows what the hell they're doing. So I think, you know, support through another mentor, peer mentor. I know I go through friends of mine. I'm like Robin Hood, you know, I chat to my economics friends and say, help train the social worker up, please, because I've got no bloody idea what I'm doing, and I run an organisation. So it's just about upskilling and finding people in your system and environment to you really, you know, like group process to bring us all along.
Sure. Thanks. And so is there any tips for just basic financial literacy? Like, what should we be teaching our children? What concepts need to be taught right from the beginning?
Well, about the need and the want is what I would normally say, you know, especially when they're young, you know. Even, for example, in the bank, we get parents coming with kids to open accounts. That time itself, that's the first lesson we need to start teaching them, you know, about how to manage your money better. What is your goal? Have a short-term goal, have a long-term goal. How are you going to reach those goals, you know? And again, about the need and the want. And also, times are not the same all the time, you know? Yeah, money is flowing in now, so it's not going to be like that all the time. So think about for hard times or difficult times, you know, is what I always say, and, you know, teach, whether it's my customers or whether it's my kids, you know. And also it's parents can start it at home, or like how Matthew said, go to a mentor. It could be anyone in your family. If they're good at managing their finances, then you can go to them, your friends. Like, for example, because I'm a banker, I educated my son. He's got a good savings in place because he's been working for the last 5 years, but his friends don't have that savings. So then when they talk and his friends say, how did you do that? And he goes, oh, my mom helped me. And, you know, and it's all right to even tell your kids that because they're working, they can't just do anything and everything with their money, you know. You need to guide them and educate them, for especially if we as parents have gone through those tough times and difficult times, we are the best educators, you know, to teach our kids. And then his friends call me, can I get some advice? I'm like, yep, happy to help you, you know. And even at work, you know, your staff, young staff, educating them, you know, though they're working for the bank, sometimes they themselves are not maybe managing their money better. You know, so I feel just that education piece, whoever you can go to. And these days, I think all the banks are quite educative, you know, and they want to educate their customers with their money, how to manage their money better, you know. And there's so many help. Like if you go to any bank's website, I'm sure there's, you know, so many tools which you can use, how to save and, you know, make the most of your money.
Thank you. I'm totally in agreement with what you're saying, Meena, but knowledge and doing can be worlds apart for a lot of people. And this is what I was saying in my speak. We need to get people into feeling the capability. Now, I know that in the Blue Notes research of ANZ have, you know, a really leading place in financial well-being. But even in the research that ANZ done, they said psychology and behaviour accounts for 64% of us being good with money. Knowledge is only about 9%. We need to be able to go beyond financial literacy. This is what makes us resilient, because when we have instability, we behave terribly. That's what we do. and that no amount of knowledge is going to get us there. Just as, you know, in your, what's happening probably in your household, Mina, is that there's not only is that knowledge, but there is this endowed capacity that's kind of ephemeral in a way. There's a holding presence. And so that we have to look at it beyond the literacy. It has to be financial. People want to feel it in their bones. I feel capable. And that's not a mental construct. It sits in our viscera. So yes, financial literacy, but it has to be more. I'm passionate about this.
Yes, we did have another question for you, Jane. How did you become a financial therapist?
So I came from a therapeutic background, a psychotherapist, and I have focused on this area. So I work a lot in the States, and at the moment I'm the only one in Australia. We don't have a system for financial therapy at the moment. My vision is that we can somehow have a mental health, a financial mental health practitioner would be, this is my vision, is that we would have financial counselors that would go and do more psychological subjects, so that they get a really great grounding of, you know, strengths-based. But yeah, we need to really look at the mental health and the capacity of people. That's where resilience sits in. It's not in the numbers. It's never really in the numbers.
So on that point, so the topic for this week, this month's mental health, is post-pandemic recovery and resilience. So just going around for each of you in your particular area of expertise, what can people do to build resilience, whether it's finances, whether it's just mental health, whether it's in general? So I'll start with you, Amanda.
So it's resilience is self-regulation, which is what Jane's talking about, you know, regulating health, diet, exercise, recovery from work, exhaustion, play, sociability, and social competency, being able to push back on your manager, being able to get another job if you've, you know, psychologically unsafe place. So that ability to be in society, those two make up resilience.
Matthew?
Yeah, well, being the social worker, peer worker, and community activist I am, I'd say resilience is, you know, community and structural and relational. I think that recovery often blames people, like as if it's all their problem and they need to do everything themselves, when in fact it's just, you know, a shitty society that results in people's opportunity and access in life. And I think that, yeah, I think resilience is in relationship and in community, you know, connect with others, connect, find belonging, find identity, find those champions and cheerleaders, and cull the haters, because they will be there. So it's just about surrounding yourself in an ecosystem of supportive relationships and connecting with your communities of choice rather than origin, because sometimes they can be the problem. Yeah. And then through that comes activism, which is, you know, the personal is political.
Jane? Oh, Jane?
Sure. Look, for me, it is about getting courageous around what is challenging in our life. Often our issues of pain can be the places for us to grow in. You know, there's some really great places, you know, quotes that say things like, you know, the cure for pain is in the pain. We don't grow in a vacuum. It's actually adversity that gives us growth, that builds that muscle of resilience. It's our capacity for us to push back and respond and rebound. Get courageous with adversity, get courageous with hard times, lean in, learn how to lean in, get support to help you to lean in. That's how we become resilient.
Jasmine?
You've all had some amazing ideas around resilience there. So I'm going to come at it from a different perspective. Resilience is really about having that strong foundation of sleep, nourish, move, and mind, because that really gives you an amazing foundation that no matter what challenge you go through, at least those things can support you through it. And obviously everything that's already been mentioned is incredible as well.
Nina?
Yeah, see, look, COVID has taught people to be resilient, you know, and the way I look at it is it's made people think about what's important for them, you know, and this is where I think we all have to, like, you know, take a step back, think about what's important, and do what you're happy with. Like what Jane said, do, you know, take the lead on what you're happy with. So many people are thinking about jobs. Is this where I want to live? Is this what I want to do? What's important for me in my life, you know, and made everyone think differently, I would say. Yeah.
Well, thank you, everyone. So that comes to the end of our panel discussion today. So really appreciate your thoughts and insights, and hopefully, well, I know that there's a lot of great tips there for the audience today. So is there anything that anyone else wants to say before we go to the next section? No? All good. Okay, thank you very much. Really appreciate it.
Thank you. Thank you.
So the National Mental Health Month is made possible by generous sponsors. One such sponsor is Mr. Bruce Wong, CEO of Foot Solutions. Join me in viewing an address from him.
Mental Health Foundation Australia is an organisation committed to improving the mental well-being of all Australians. Foot Solutions' vision and value are very aligned with Mental Health Foundation Australia, and we have been supporting this charitable organisation for over 2 years now through various programs. We have been very involved in the meal delivery initiative organised by the foundation, which was a huge success last year and has continued this year with over 85,000 meals. Month awareness campaign run by the foundation, which brings the Australian community together to raise awareness, stand the stigma, and initiate conversation about better mental health and importance of mental well-being, which is required now more than ever. And one thing we can thank the pandemic for is bringing mental health to the forefront, creating the opportunity for more open discussion to be had, furthering the breaking down of stigma and the opportunity to really look at what is required in the mental health space. Another thing we can thank the pandemic for is platforms like Zoom, which help bring us all together in such a wonderful way. This year, the foundation is launching for the first time the Mental Health Appeal on the 10th of October to raise funds to develop a program to educate the community in a hope to prevent youth suicide. I commend the important work Mental Health Foundation Australia is doing in the Australian community, especially within the multicultural cohort. My best wishes and appreciation to Vasan and Jim for providing excellent leadership and direction to this organization. Foot Solution will continue to be involved with the Mental Health Foundation Australia and its initiative in improving the mental health of all Australians. I encourage you all to interact with more events during National Mental Health Month, which you can find out more about their website. www.mhfa.org.au. And thank you and enjoy the rest of the event.
Thank you, Bruce. I'd now like to thank each and every one of you for joining us today at this important discussion.
Foundation Australia.
It has been a great 2 hours of learning and lots of information to take away and ponder over. I'd especially like to thank all our esteemed keynote speakers. Dr. Amanda Ferguson and Jane Monica Jones for sharing an in-depth and insightful address today. Jasmine Wolfe, who facilitated an excellent meditation session and provided some excellent practical tips for us all to use. Thank you, Jasmine. And thank you to Matthew Jackson for sharing your journey, and your participation is much appreciated. And Meena Vagish, you added immense value to the panel, and I'd like to thank you for the time you have taken to join us today despite your tight schedule. Events like these are of immense importance. To make this possible, we need sponsors. Chemist Own, Australian Unity and Foot Solutions are key sponsors for the National Mental Health Month event, and I'd like to extend my sincere thanks to them. This has been a wonderful event, and thank you all who joined us today, both via Zoom and Facebook Live. Thank you very much and have a nice day.